we actually held an agriculture forum here back in April. And another great way for me to hear the concerns of my constituents today is to have this healthcare forum. And I always say that the best ideas really don't come from within the walls of Congress. They come from the people who are actually out there every day, working in the field, you know, living your lives out here in the district, and you understand the struggles. And I need to hear what they are in your particular area of expertise and where you have great ideas that we can take forth to Washington. Excuse me, I'm just at the end of a long cold. I am on 3 committees, excuse me, agriculture, small business, and science and technology. And it's interesting because all 3 of them do in some way cover healthcare. And you might think, well, agriculture, where does that cover healthcare? Well, we're talking about feeding people, and much of our health, of course, starts with what we're eating. And all of the federal food programs are funded through the agriculture, through the jurisdiction that we have over USDA at the Agriculture Committee. In small business, I'm the chairwoman of the subcommittee on healthcare and regulation. And through that position, I held a forum similar to this in Washington, where we had all of the organizations that represent you on a national level came one morning, and we sat for 2 hours, and we went around the room, and everyone was able to talk again for about 3 minutes and had a good discussion back and forth. And the chairwoman of the committee was there also that day. And then on my Science and Technology Committee, of course, we're talking about the latest in science, and we're talking about grant programs that help biotechnology and some of these industries that are making your job cutting edge in the world. And so we're talking about that. And the other thing is health information technology. We had a excuse me, hearing the other day on health information technology and talking about the struggles that hospitals and physicians and other ancillary services have with connecting and the cost of those systems, but yet we realize the importance of that. And I just look at my own situation. I have a father who lives in Erie, and he went to my sisters in Detroit, and then my brother's in Fort Worth, and then my daughter in Memphis, and on the way between Memphis and back into the hospital in Indianapolis. And in every one of those cities, he had health care provided to him. But yet, those places can't really talk to each other very easily, and how much more efficient and cost-effective it would be if they could see what had just been done in the previous city in terms of blood work and testing and those type of things. So we know health information technology will help save lives, improve care, and hopefully drive down costs, but we've got to spend a lot to get there. So we're looking at that end of things too. In fact, I have a piece of legislation that I just, what they call dropped last week, that will actually provide loans for the small practitioners to be able to access the capital they need to buy the health information technology that will help them connect into that system. So as we look at healthcare reform, I think everyone knows that we have to do something. And that's the difference between now and the early 90s when we tried to do this before. Everyone is sort of at the table. Businesses, insurance companies, some of those who maybe didn't want us to do healthcare reform or kind of fought against it back in the 90s, realize that the system today is unsustainable. And Dan Shea brought up a lot of statistics that I'm sure you've heard numerous times, and those statistics are daunting. And when you hear the statistics about where we rank in the world in terms of our health care, I think that is a surprise to many, many people out there who think we have the best health care in the world, but we do not. And when we talk about rationing health care, those of us who have good coverage may not feel that way, but those who don't have coverage very much feel that they already have health care rationed to them. So hopefully we're going to come up with a system where people don't feel like it's rationed, but we have a system right now where it is, and we have to find a way to cover everyone in this country. When I talk to a young gentleman in his 20s who tells me he set his own phone because he did not have health care coverage, we've got a problem. When I talk to a young mother who says her child had a double ear infection, but she didn't have the money to pay the doctor, so she didn't take this child until it became a really big problem and they ended up in the ER, that's a problem. When I talked to the couple who came up to me in Butler, and they had declared bankruptcy. Her husband had an issue with his brain, and they couldn't figure out what was going on with him, and he had to have numerous tests and surgeries, and they ended up with over $30,000 worth of fees that they were not covered by them. They had health insurance, but were not covered by the insurance, but they didn't have the money to pay for that $30,000. They had to declare bankruptcy, and as they held each other's hands, and they said, but we still have each other. We have a problem in this country. So I want to hear from you today, and I want to hear where you think we should be going as we come forward with this debate. The next 4 weeks are going to be very busy in Washington, and you're going to hear a lot, and I want you to continue to input your message to us and to others, Senator Casey, Senator Specter, those who represent you, so that we hear your message down there. We hear messages, and believe me, my staff takes those messages, they bring them to me. I know who's calling, and I know what people are calling about, and we need to hear from you as we go forward. So what is health care reform going to look like? We need to reduce the cost for families, business, and government. We need to protect people's choices of doctors, hospitals, and health plans, and we need to assure that everyone in America has affordable, quality health care. We deserve this. I think it's for our national security, I think it's for our economic security, and it certainly is for the good of everyone in this country. So I am proud to be in Washington right now at this time. This is something I ran hard on, that we have got to have health care reform. There are certainly several proposals in front of us in Congress. There's been a lot of media attention on the Senate side. Of course, I can only vote on the bill that will come out of the House side. It's 854 pages. I'm still reviewing those pages, and I look forward to your input today as we go through your discussion and your testimony. So with that, I'm going to turn it back over to Dan Shea.